Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hi, I'm Nicola Barber and I'm 57 years old now. I was first diagnosed with cancer in 2011. Prior to that, I am married with 4 children, all grown up now, and a wonderful husband who's been my rock. My husband was in the army, and consequently we've travelled all over the world. I've always been very fit and healthy, never had any real health problems, just having 4 children, that was enough. And then in 2011, the bombshell hit. I hadn't been feeling very great, and I did notice I'd been putting weight on, and I was getting a round face and one thing and another. I just generally didn't feel right. And I went to the doctor first of all, and they said it was high blood pressure. And then I went again, they said, oh no, the hair growth, and that's your hormones, it's your age, everything else, and I thought, no, this isn't right. And then at work, the girls kept saying to me, are you all right? Are you sure you're okay? And I went back and saw yet another doctor, and who did the blood tests, and lo and behold, I was diagnosed with Cushing's disease in September, which flagged up a great huge tumour on my adrenal gland. From there, it was very quick. Within a couple of weeks, I was in hospital having the tumour removed, and metastases were found, unfortunately, on my lungs.
So Nikki, thanks for coming in today. You come in to share your story, and I heard from the biography that you have an adrenal tumour, which is an unusual cancer in a way, because it's one of the ones we don't hear about very often, but it's valuable for you to come in and share this experience with everyone, so thanks for that. Can I ask you about a little bit more, I know you mentioned it in the intro there, but about how it did come about, because you actually were presenting with symptoms of what could have been another condition, i.e. an endocrine disorder, Cushing's disease.
Well, yes. I mean, I do have Cushing's disease. That was the diagnosis I had to go through first, and I had to go through the various stages before that was diagnosed. Various blood tests, scans, one thing and another, various trips there. That was the start of it. As I work for the NHS, and what have you, I'd sort of done quite a bit of research anyway, yes. And before they even diagnosed he said to me, what do you think it is? I said, it's Cushing's. And obviously then I knew that what could be the worst outcome or the best outcome. You know.
What was your job then, by the way?
My job, I'm assistant practice manager at a GP surgery.
So you also could ask advice, I guess, from your colleagues?
I didn't actually.
Yeah.
I tend not to. I find I keep, all they had to do was look at me. I mean, obviously they obviously had a good, they knew.
They could see a change in you, maybe.
Yeah. But they just saw you as well. So you know, they were very, you know, persuasive in me going to the doctor.
Yeah.
In the first instance.
Who was it that actually picked it up when you were mentioning then that you thought it was Cushing's? Who was it that was agreeing in a sense?
Would you believe it was our health visitor who's also a nurse? It was her. She's in fact she does now do acupuncture, and I have seen her for acupuncture as well. She's helped me through quite a bit of just for you know, sleeping and one thing and another with acupuncture too. What
were the main symptoms you were suffering at that time?
I couldn't sleep. I was hyperactive, but running around like a bunny on speed, or one of those, I also myself as those Duracell battery rabbits, you know, running a lot but not gaining a lot. I used to start things but not finish things, and I just knew that this wasn't right. This wasn't me.
Did it alter your thinking at all?
It did in a way. I just was very irrational. Not, well, it wasn't right. You know, just jump from one thing to another and then forget what I'd done in the first instance, and it was having an impact on all areas of my life, really.
Yes. So it was hyperactive in a way, but not productive with it.
No,
so it was not actually really paying off being that, you know, hyperactive. It was actually a detriment to you.
Well, yes. Apart from the fact that the house was exceptionally clean and and things like that, but nothing really, you know, greatly, because I'd start something but not finish it, and then forget why I was doing it, and then go on to the next thing and what have you. And I think it first was brought home to me very greatly how really unwell I was when my sister from Canada came to visit. We had planned a trip over 2 years previously. We had talked, when could we do this little trip? We were going to do a trip of where we'd all lived as children.
Wow.
Her and my brother, one of 3. And we were going to, because we'd brought up in Scotland, we were all born and brought up in Scotland. So we were going to go back around areas that we'd lived in and have a little look.
Yeah.
And I hadn't told her I was unwell. I knew I was unwell before she came. And we went to Manchester Airport to pick her up. And I thought, right, I'm going to have to tell her, aren't I? And she said to me, she came rushing up to me in the arrivals, and she said to me, she says, are you all right? And I said, no. She says, oh, thank God for that. She says, I thought you'd had a bad case of Botox, because I had a big round moon face. Pictures of which are with my endocrine surgeon at the moment, because he keeps them. I take photos every time I go to help him build up a portfolio for his students.
Oh, that's useful. Yeah.
I have pictures of me with a great big round face, going back down again, slightly back up again, and what have you. And I'm kept under control by him very much. Because
one of the unusual things about Cushing's, it increases weight, doesn't it? But often centrally around the core of the body or the face. And that can be a distinguishing feature sometimes. But somebody then made a link between the Cushing's and what was the cause of it. So how was that made?
That was done through scans. And they thought we'll have a scan you, and then they found out this great huge tumour on my right adrenal gland. He said normally his tumour is probably about 1 centimetre. He says you've got at least a 6.2 centimetre, rather large tumour on the adrenal gland. And then they found metastases, unfortunately, on my lungs as well. This is when they first mentioned the word cancer.
Yes.
And
how do you feel that was handled at the time by the team?
I think it was handled very well. When I saw Dr. Levy, he said to me, he says, I don't like to give people this, he said, but he said, I will be referring you on to oncology. But he did say to me, he said, go away, he said, with your husband, because he always came with me for every hospital appointment. And he says, go away with him, come back, and he says, have a coffee, have a think. He says, be gone as long as you want. He says, I will be here and you can come back and talk to me if you want. Because, or if not, he said, if you want to go home, just phone me and I'll speak to you.
In a way, that's a nice way of doing things, because when anyone receives that bad news, you know, that information about, cancer, often you can't take in what you need to at that time. So having like a period where you can revisit is perhaps a good idea.
It was for me, especially because all I said to Graham was, let's go home. I don't think it computed really. I thought, right, okay, that's okay. Tell me that now. Let's just go home. I just want to go home.
Yeah.
Yeah.
And you'd have another chance to talk later anyway, wouldn't you?
Yeah. Oh, most definitely.
Hopefully, you know, in a short space of time. So what did you manage to find out? Because you had access to medical information.
And what I found out that the metastases on the lungs and what have you, or you get ovarian metastases, which is more common than the lung ones. Lung ones are very rare, and what have you. And then I read up on treatments and prognosis, and neither was very helpful really. So I thought, stop reading about it because it's making you worse. You know?
That's a controversial area, isn't it? Because anyone can go on the internet now and look up information. Really, the difficult thing is, are you finding good information, i.e. information that's useful to you at that stage, or are there some sorts of information which really aren't that helpful?
I find a lot of them aren't that helpful. They're more scaremongering. It's always I think we all focus on the doom and the gloom instead of the positive. You know, at that first stage, I think it's always doom and gloom to begin with. And until you start your journey and you find out what can be done, and you have to take each stage as and when it comes.
When you're having kind of that information that's perhaps one negative on top of another, there's a lot, you know, that's weighing down on you. But did you find there was a certain stage where maybe somebody came along who was giving you more hope or encouragement about what they're going to do and what the future might hold?
Well, yes, when we finally got, then I didn't start treatment. This was in September. I had the operation in October, but I didn't start treatment until the end of January. Right. And because it's such a rare cancer, it's dealt with in a rather unusual way, in which I have to have blood tests. I used to have blood tests every 3 weeks, and it was a drug I took called Mitotane. And you have to have a certain amount of Mitotane in your bloodstream for it to start working. And they start you off on the lowest dose, and then you go on with that. And I was never ever reaching the right level in my blood. It was always far too low. And I was on the maximum dose and it was still on the low side, and I was starting to really despair that I was ever going to reach the right, you know, this was ever going to work for me, because as I was told, this is the only real treatment they have for this type of cancer. There's no other type of treatment. There's no surgery, there's nothing else. This
was prescribed from the oncologist?
The oncologist, yes. Which was always a deep joy to try and get the tablets from the pharmacy, because the first time we went, they were ordered in. The second time, they weren't there, and so forth and so forth. This was every time we used to go on, and they would only order them a month at a time because they were so expensive. And I don't know, that made me feel even worse, because I thought, are they expecting me not to be here next month? Was this what they weren't expecting? You know, we're not going to order you, know. Yes. And it was all very negative to begin with, you know, and what have you. And that really wasn't good for me at all.
In a way, that was an additional burden, coping with that regime. And
it was, but then again, in the end, but we used to laugh though. We used to make a joke when we used to go to the pharmacy and you see other people there and you think, yes, I'll probably see them back when I come back another hour, because they still won't have, you know, wondering who got their drugs first. You know, we used to do, because you have to make, otherwise you'd go stir crazy, I think, you know. Looking
back on that time, are there some lessons that we can learn in the medical profession about what could have been done differently?
I think, you know, there was never any, when you went to the pharmacy, it was always, well, you have to speak to somebody else. No, they're not here. No, you know, nobody ever wanted organisation, you know, and things like this. You know, I understand these things are expensive, and yes, you don't want to overload them. You know, but I did at that time. The treatment, he was prescribed for life. They said to me, you have to be on this for life if you can tolerate it, because each person has obviously a different rate as to when they can say, well, enough is enough if you become unwell. But to begin with, I was fine. I had absolutely no problem at all. You wouldn't even think I was taking tablets. And you read, you know, the 50,000 side effects. Well, same with any drug, isn't it? Even an aspirin.
Yes, on the leaflet, yes.
The leaflet, you'd never take anything, would you?
No.
But you can't be like that, sure.
I know what you're saying. You give it your best shot.
You do.
And what was the result later? Because I know you said just there you had to go on a higher dose in order to achieve the level.
And I did eventually get to the level.
Oh, that's
right, the right level.
But did it mean that then there were some side effects?
There were. The side effects started to kick in. Total lack of appetite, extreme tiredness. There were times when I was at work when on my lunch break I could have just quite happily laid down and gone to sleep. I found it very difficult sometimes staying awake and what have you, which in turn led to me being, I got very down about it all and everything, and I used to feel so sick at times and just really, really horribly unwell. I think the same like most people get from drugs or any type of chemo they're on. And eventually I did actually have to have time off work, which I hated because that's not in my ethos. I wasn't going to give in. There's no giving in with me, I'm afraid. I fight everything.
So you were really struggling to stay at work, which is, you know, admirable and usually actually helps somebody's outlook and their quality of life if they can stay at work.
I think that was okay to a point, but where I work as well, a lot of it is, you know, sort of work which I was doing wasn't always the most helpful either, really. Because
there are lots of medical things going on.
Yes, that's it.
A lot of unwell people there.
Oh, yeah, this is it. You know, I found it sometimes a bit of a struggle, you know, there that way, but there's always people a lot worse off than you are.
Although on the other side of the coin, did you find it still giving you a role while you were
most definitely. And I think as well, I know it sounds silly, but I always felt okay going to work, that it's safe, if you like, in a safe environment.
The people around.
And my work colleagues were exceptionally supportive of me, you know, were always so kind, and work as well was, you know, because I used to have time off to go to the hospital a lot and what have you, and you know, always very, very supportive and asked how I was and everything else, and things with scans coming up and things, you know, used to be very supportive of me.
So they, as an employer, they were actually quite understanding of your needs.
Most definitely, yes.
And what about the contact that you had through those colleagues? I mean, like, in a way, was it useful to have that extra support through them, or the social contact maybe?
Well, yes, because I have a lot of friends I see out of work as well.
Yeah, that's what I was wondering.
Yes, it did. That helped a lot because they understood the situation. You know, I'd go for a little while. I'm sorry, but I'll have to go home now. That sort of thing, and they'd be quite understanding of that. I also have a very close network of friends, some very close friends. I have there's 5 of us, as we call them, girls. We're not actually girls, are we? Our age, that tend to go away once a year, and I still managed to do that. I went to Barcelona in September, and they all knew my limitations because I did say to them, I said, you know, if you'd rather I didn't come, you know, I was quite willing to drop out, but no, you come. And they all looked after me extremely well and everything, you know.
In that social circle, what do you prefer regarding the kind of conversation? Do you prefer that they ask you about your health and you give them an update, or do you prefer just to talk about regular things?
I think talk about regular things. You know, they say to you, are you okay? I go, yeah, I'm fine at the moment, and we just leave it at that, you know. Although, I have to say, after every hospital appointment, the poor Graham, my husband, my long-suffering husband, he was very good. He used to do the phoning round or the texting round because the family, with having 4 children, they all needed to know immediately that we came out of the hospital. What was said now? What are we doing now, Mum? What are we doing, you know? And he took all that responsibility off me and he did it for me. So I was very fortunate in that he did all that for me.
So he used to come and then like be a double check for the information, did he?
Yes. Oh yes, he used to ask questions as well and things. You know, have his own questions.
Do you think that is an important kind of strategy then for medical appointments?
Most definitely. I think because if you're living with somebody, they need to understand what the person is going through, and they also have concerns as well. They see things that maybe you don't see, the way you're acting or the way, you know, things are going with you. You know, you might be thinking you're doing it perfectly all right, and going to be going, well, no, actually you're not, you know, and what have you, you know, because he knows me more than better than anybody else, you know.
And I guess another advantage is they're fully involved in the care process, aren't they? So there's no question of miscommunication. They hear it firsthand, just like you do. But I guess that also raises a question about how did he manage, you know, himself?
I think he goes away to work a bit, and when it was his release when he went, because he works away occasionally, and that was it, to get a work right away was probably a good release for Graham. And what have you, and having the family around him too. Although he does not talk a great deal. He'll talk to me, but he does not talk about it a great deal, you know. It's just something he finds hard. Because I did ask him to come today, and he says it really wasn't for him. He says, you don't mind. He says, if I really wanted him to, he would have done. I said, well, no, if you're not comfortable,
that's totally fine.
That's fine by me
point of view.
as well. You know, I don't want to pressurise him into. We've been through an awful lot. He's seen me at the worst stages I could ever be, I suppose, and he's always been there. You know, which I'm eternally grateful, and my family as well, and friends and everybody else. You know, and work colleagues. Because the times when I was off work, I was getting texts, phone calls. You know, are you up for a visit? Shall I come and see you? You know, things like this, which I'm very fortunate to have had.
Tell us about that period off work. How did you make that decision about finally taking some time off?
I had to. I just felt I just couldn't cope anymore. It was just too much. I was so tired. I felt so ill, and it was taking me all my time just to get dressed in the mornings and things like that. I think I just can't do this anymore. So I thought I'll have some time off work. One of the things that kept me going a lot of the time when I was off work, would you believe, it was the Olympics.
Yes.
And I used to sit and watch the Olympics, and that actually gave me a lot of hope, because I thought these people worked really hard and gave everything to do what they were doing. And I used to get try and engross myself in that and think about that. And as well, the Paralympics as well, people overcome so much to do what they do.
Yes.
And I'm thinking, well, you know,
they're all inspirational in their own way, aren't they?
It is.
And in a way, you can take something from their, you know, abilities and their drive, and say, well, can I do something? But I wonder whether can you still apply that when your baseline is lower than you want, you know, when you've had that setback?
I think so in a way, because it was a diversion for me. You know, I immersed myself in that. Oh, let's look at the league tables. Let's look at this. I'd watched sports I probably never would have watched in my life before, you know, and things like that. And I sort of, it was like a release, if you like. If I was watching that, I wasn't thinking. You know, I could just, and have something to say to Graham when he came in from work, rather than how are you or what have you been doing today. Well, so and so happened, you know, and what have you.
It's a nice distraction. It's also shared by the nation as a whole, isn't it? Or the whole of society in a way.
It was if you like, a better year to be unwell, or as unwell as I was that year, was to be that. And music is another thing I get a great deal of pleasure from too. Just listening to different songs, and I think, I don't know, do you listen to them more intently? Or whatever. With anything, you know, you get more immersed, you know. And I never used to shy away from watching anything on the TV that mentioned, because I don't know, it's like anything I think in life. Whenever somebody says to you, oh, you've got such and such, next time you turn the TV on, somebody's got it on some programme or something, or it comes up in the news or anything else. It all seems to be more highlighted. Or maybe we just notice it more, I don't know. I think
that's the thing. When you're sensitised to a condition, you tend to notice it around, either in other people or in the news more. What's your reaction, though, when you hear cancer mentioned in the news?
I suppose I was listening, maybe if they were talking about maybe new research or cures or whatever, be more intent and listening and thinking that is good, you know, and what have you. Maybe in my own way, I used to get a little cross that they always talked about. I don't say common cancers, but cancers that a majority of more people seem to have. Then nobody mentioned the cancer that you had, you know.
Do you think there should be more coverage for adrenal cancers?
No, not really, because I don't suppose there are that many people. Like they said, the research goes, and I do understand that, goes into the ones that I don't know if the word common's not the right word, I don't quite know what is the right word really, the more known cancers, or the greater number of people that get that cancer. I think, yes, the research should go into that first, because that will save so many more people, you know, than ones with sort of rarer ones, you know.
Would you identify with people who have different cancers, or do you think your condition is quite unique and really you'd identify with somebody with your specific condition?
No, I've never ever, no, because I've never met anybody with my condition. I've only ever seen people with others. So no, I think anybody with cancer, whatever type of cancer, they all have to, we're all in the same boat. We've all got that cancer, you know.
Yeah.
And yes, there are different treatments for it, for each and every one of us, and whatever works for you is fine. I mean,
did you have the opportunity to meet any other patients who did have other cancers along your journey?
Oh yes, I did. Through, you know, as you talk to people in the waiting rooms at the Royal, second home for a year, you know, you do get to talk to people. You see the same people again, and you think to yourself, oh, well, maybe they look a little not so well this week, or they look better than they did last time, and things like that, you know.
Is it useful to have those contacts? Did you find it some way encouraging, or maybe you could encourage them? I mean, how did that tend to work?
Well, yes, I did, because you exchange, you know, or like, here we are again, you know, how much more blood, you know, like, well, yes, and you usually actually talk to, when you were sitting waiting, you probably talk to maybe their relatives, not the actual person with the cancer, because they'd be having the treatment or whatever, and you'd be sitting there waiting with them for your turn, and they'd talk to you about, and you say, yes, so you spend most of your time here. Or you talk to people, yeah, I've got much more blood to give, you know, we've been here, you know, the third time this week or whatever, you know, and things like that. And, you know, and everybody gets quite upbeat, I think. I think we try and keep each other going as well.
Do you think that should be organised, that system of meeting other patients should be organised by the hospital? For example, you know, we've been trying to set up group therapy, and group does exist elsewhere, but there are other forms of peer support, it's called, when patients meet together.
Oh yeah, I think that's a good idea, you know, because sometimes you can talk to your relatives, your loved ones, your friends, but when it's actually happening to you, it is very different. And sometimes you don't always want to be talking about illness and drugs, and that can get very wearing for everybody. People don't want to always hear about that. Yeah. So when you're talking to other people and you're hearing them, it's like it's a release, and a release for you. You know, they understand more so than people around you, yeah. Did
you have any particular contacts that you made, you know, basically friends with and then stayed in touch?
Yes, actually, my next door neighbour, she's had a double mastectomy. In fact, she had cancer twice and what have you, and we became exceptionally close, you know, and what have you, you know. And she was always good to talk to, you know.
It's good to have that, in a way, source of support. But like I say, it works both ways, doesn't it? So you can support each other in a way.
Yes, oh definitely, like that, yes.
What other resources or sources of help did you come across in general that you would say, oh, well, that's worth knowing about?
Well, I think the Macmillan part, just as you go into all that was very good knowing about. And then we have, in Loughborough, we have another outreach post that we could go to if we wanted to. Yeah. I never ever did pluck up the courage to go so far. I mean, I know I can still go, but I have never.
Is that a support group, in fact?
It's a support, and also the support group, and they do therapies and things like that as well. Just drop in, you know, befriend a support group as well.
Is that with the voluntary sector, Coping with Cancer?
Yeah.
Yes, I know the one you mean. They have a branch there.
Yeah. And I don't know why I was never ashamed. I'm not ashamed to say, you know, you can't be, because, you know, and I never was worried about it, you know, but it's just something I personally didn't do. Yeah. But I know it's there if I ever do need it, you know.
It's a resource that you know is there, so if you need to access it, you can.
There are sort of all resources, you know, and there's always the Macmillans and people like that all around that are always good to help. And yourselves, of course.
You had some contact with our service, didn't you, a while ago now?
I did, yes, that was last year. And that was very good, which led me on to then being able to come to the groups and what have you.
Yeah.
But at the moment I'm doing exceptionally well. I'm no longer on treatment because I've had a scan in February that showed that metastases have all gone at the moment. So they don't use the word cure, do they? They use the word remission. So I'm now just on follow-ups.
That's excellent.
Which is very, very good. As he said, we've never seen this before. But there again, as I am an old boot, as I had a little glitch in January where I had a little heart problem, and they found out that my left ventricle down the bottom is the boot shaped. So my husband now says, I can officially call you an old boot now, can't I?
Okay.
So I'm different in all ways, I'm unique in all ways.
You've got that new issue to contend with.
I have, yes.
Is it causing you any symptoms, that heart problem?
No, I had this one episode and I had a stay in the Glenfield Hospital where everybody was absolutely wonderful in there. That was a really different experience, that was. And I've had no problems ever since.
That's good. Back to this really good news then about your metastases clearing. I mean, that's very, very unusual for that to happen, but it's excellent that it has. Do they attribute that to the drug you're on, the Mitotane, I think you mentioned earlier?
They did. I did stop that at the end of November because they did find that the blood levels were exceptionally high in my blood. After all the time I couldn't get them to go up, they went too high, and we stopped it for the time being. And before I went back on it, I'd had the scan to say that they'd all gone. How
did you feel about all that information? I mean, there's obviously that good news, but then you could have an uncertainty about stopping the medication that could have had a therapeutic effect. I don't know. What did you think?
It was like, I feel like losing a lifeline in a way. These drugs were like, I think, oh, they were helping me, you know. But as they seem to have done at the moment, done the trick, I do know that if this person was to come again, I could go back on them. But the downside to it makes you feel so really unwell. And of course, when I got the news to stop them, it was lovely, but it still didn't make me feel any better.
I was about to ask you that, because I'd be very interested, given these side effects, what was the effect physically with stopping the drug? Did some of those effects disappear, and then you really knew they were related to the drug?
They've taken a while to disappear. And yes, they were definitely related to the drug. The extreme tiredness and the sickness and that has all gone away and what have you. And if you speak to anybody in my family, they'll say, you're like your old self again. We've got mum back, you know, and what have you. So
in a way, there's two bits of good news. One, the cancer being in remission, and two, the drug not being needed right now.
This is it. And that to me is really good. That isn't needed at the moment and what have you. But they do say it takes a good 4 months for it to get out of your system. So I'm just coming up to that sort of period now. You know, just over that now, just stopping. It's all gone out of the system. So in
a way, you could be considered to be in a kind of recovery phase, the end of the recovery phase right now.
Yeah. I must say, when we did get the news that metastases had gone, I think it took us about 3 days to even understand that and the implications, what that really meant. I think we went home, the two of us, and we sat and we just looked at one another and didn't do anything. And then I cried a lot, and we sort of were in hysteria. I feel like we didn't sleep. We couldn't do. It was a really up and down phase. You know, I think relief. It's not even relief to begin with. It's just like you don't. It's like when they tell you you've got the cancer, and then they tell you, well, actually, your cancer's not really there so much anymore. It's like really in the background. It's, oh, you can't understand that either.
Have you been able to really take that on board and absorb that information?
I think so now. It's just taken me a long time, but it really has. I still have to go for scans, and whenever I have to go for a scan, I always do get a little twitchy beforehand, because you never know what it's going to show, you know, till you go and get the results. And you can actually say again, you know, you're still in remission, you know.
I have had people say to me that they are nervous about taking good news on board because they've lived so long with uncertainty that they don't want to give themselves news which is incorrect or too positive. Does that make any sense?
Oh yes, yeah. You're always waiting for something. Yes, that is that. But you know. Yeah, maybe should never, I don't know, down-cry ourselves too much. We should really take it on board. But I think it's a lot to take in after you've had such an intense period of everything's been the doom and the gloom.
Yep.
And you know, and then getting this, you know, it's wonderful news, you know, and in a way, you don't miss going to see your consultants, but it just doesn't seem. It seems a bit weird not going as often as you did to begin with.
Indeed, and that can create a little bit of anxiety about not being monitored as frequently.
It does in a way, but it's that devil's advocate. You do want to be monitored and you don't. If you don't know, then we carry on fine.
Yes.
If you do know, then there's the consequences, you know. So it's a bit like the ostrich, put your head in the sand for a bit and carry on and let's play the normal game, you know.
The ideal is not feeling you have to worry about there being a little bit of less medical scrutiny, but the positive is getting on with, being able to get on with your life more, do normal things and feel you're getting your life back on track. Did you manage to return to work?
Oh yes, I've gone. I went back to work. I had about 6 weeks, in total about 6 weeks off, and I went back to work. But when I went back to work, I decided to give up my role as it was, as a vacancy had come as for a practice secretary instead. And I had decided to take that with less pressure, less hours and less responsibility, because I still wasn't, I was on the height of the drugs still and wasn't well. And I thought I wasn't being fair to the people I work with.
Do you think that was the best decision for you?
At the time it really was. It took a lot of pressure off me, and just working 3 days a week was a lot better than doing the hours I was doing and the extra and everything else. That was the best decision for me.
How's the work going now for you?
At the moment, I would say I'm just finding it very easy, if you know what I mean. I'm finding I'm looking now for more things to do.
You want a few more challenges.
A few more challenges in my life. But on the other hand, having had cancer and having this cancer, it's made me think about life in general and thinking, well, there is more to life than work. You know, enjoy my life with my family and what have you, and doing things, and that is the better way for me to go, I think.
It's helped you look at your priorities again.
Well, most definitely. I look at life in a very different view now. You know, there's always a lot of people a lot worse off than you and everything else, and I cherish every day that I have with my family and my friends, and being able to just feel normal and get about and do things I enjoy doing that I couldn't do before. Like love of cooking. I really, really enjoy cooking, always cooked. And for a lot of months I didn't want to eat anything, so I wasn't interested in cooking. In fact, my husband took on that greater role for a lot of the time. Otherwise I don't think he'd have got anything to eat, poor man.
So you've taken back that, that love of cooking that you had at one time. And
control. I mean, he did an awful lot around the house and everything else. In fact, he took control of most things, and I just let him, if you like, because I felt so dreadful. I just didn't have the energy or the thought to do it. So, but now I'm getting my life back and doing it my way. The way that we always do it is my way.
Is there anything you're still held back from, or do you feel that it's a good balance now?
It's a good balance now. Now that I suppose, in a way, sometimes if you talk to my husband, he would say to me, he says, I'm overly enthusiastic about doing things now. I find I get greater delight from doing things, things that, or see more in normal things that probably you didn't see before. You take greater pleasure in the smaller things in life and what have you. Everything's a bonus to me, and probably have more empathy with a lot of people than and patience than I probably did in the past,
Yes.
Because to me, whatever anybody feels, no matter how they feel, to them if it's a big deal, it's a big deal. How small or how big it is,
Definitely, that's a good way of looking at it. And would you say that then, overall, there are positives that have come out of this whole experience?
Oh yes. It's made me reevaluate what is important in life and things like that, just being able to get up and and feel good in the morning, you know, not having to drag yourself out of bed and do it because you have to, do it because you want to.
Yeah.
And there's something to look forward to doing that day. It's something you want to do, you know. That is, to me, is a great positive. And what have you.
Where do you see yourself going in the future now?
Well, I'll continue just doing the short days at work, and hopefully we're going to start doing a bit more travelling again now I'm well. That we've always enjoyed doing. That was put on hold greatly. We were married 40 years last year, and we always promised ourselves a lovely, huge holiday after as well. We managed a very poor week in Spain. I think I spent a lot of it in bed because I felt so ill and
you
dreadful.
You weren't well at the time when you went?
When I went and enjoyed what I did do, but it wasn't what we would normally do.
Are you still glad you went, though?
Oh, yes.
And that can be a message for other people, that it can be valuable to try to do a little something, even if you feel unwell at the time.
It is. I mean, Graham used to leave me since I went and go off, and because I felt I'd hold him back, because we're great walkers and explorers and doing things. He'd come back and tell me what he'd seen. He says, well, I found a way, maybe we could do this. He was very good at that. We'll get a bus, I saw a little bus train thing, we can go and do that on that, and we can go and look at that and doing that. So never ever discount doing anything, always give it a go. And never be afraid to say, I'm sorry, I can't do that.
Yes.
Yeah.
Know your own limitations.
Yeah.
And from the perspective of a viewer who's watching this, and they may be newly diagnosed or a relative of somebody newly diagnosed, is there anything you want to say to them to give them some insight or encouragement?
I think always talk to each other. That's always tell each other how you're feeling, because we all feel things in different ways. I have never felt why was it me? That never has ever crossed my mind or anything else. I never really got angry that I had cancer. I was sad that I got it, and I was sad the effect it had on my family, because it has had an impact, and it will have an impact on your lives. I'll tell it to anybody, it will have an impact on your lives and your people around you, because I think sometimes people do view you slightly differently.
Yeah.
They can be either a little insensitive of what they might ask you as regards your treatment. It's like one lady asked me, oh, when will your hair fall out? Which it never did with the treatment I was on. And I thought, well, if it did, it wouldn't have mattered anyway, and things like that. Or other people might be a bit wary of you as well. They don't know what to say to you as
Definitely,
well.
that's quite common.
And I found that was quite common. People would sort of look at you but not say anything. And always make the first move. Never be frightened to say it, because it's only it's an illness. That's what it is.
You're saying don't avoid bringing up the idea that of cancer, the word, if you feel comfortable. But
it's got to be you. Got to feel comfortable. If you don't feel comfortable to tell anybody, it doesn't matter. You can be as private as you like or as public as you like.
I think that's good advice.
Yeah. I'm. If people would ask me about it, I would tell them, but I would never volunteer the information, because it doesn't make you a different person.
Yes. You're still you.
You're still inside. You. Right inside of you, you are still you. A lot of people see you as somebody a bit different, because, how are you doing today? Have you done that? Well, it doesn't matter, You wouldn't have asked me that normally,
Did you find when you were really unwell that people often did treat you just like an unwell person, not like the old you that you wanted to be?
I think so. I have to say, look, most children, I've found my children from me, I say, you're right, so I'm fine. No, you're not fine, Mum. I said, well, why are you asking then? Things like that. I'm not feeling that brilliant, but no. But I'm here.
Yes.
And the things I did find, and I imagine who's newly diagnosed cancer will find it difficult, maybe it would be the same for other people, was family occasions, when we always used to get together, because we're having a large family and having 6 grandchildren, things like that, and birthdays and Christmas and things like that. I found that very difficult. I used to look at them, and I think you always do when you're first diagnosed, oh, I'm going to really enjoy this birthday because it's this last birthday I'm going to see you for, and things like that.
You felt that pressure of the occasion.
At the beginning, I think at the very beginning, but after a while I did find it difficult to go to things like that. I used to get quite emotional. But after a while, they all go on, and you just have to just go and enjoy it, you know.
Yeah. You brought a memento in today.
This is my my blanket. It's sort of a childish thing or whatever. I have a sister who lives in Canada, and as I said, she came when I first was unwell. She was back home before I was diagnosed with cancer, and she sent me this blanket and said, with a little note in it, says, if you ever need a hug from me, just wrap this around me. Well, I use this an awful lot during my cancer times when I wasn't well and I couldn't sleep. I just come downstairs on the couch and hug my blanket and talk to my sister, even though she wasn't there, with the time differences and things. And that's helped me a lot. Yes,
it's key to have those contacts who you really rely on and are supportive for you.
Yeah, and I used to talk to our two dogs who are no longer with us, photos and things. And sometimes it's best, sometimes you just talk to yourself. You get a lot more sense from yourself, talking to yourself. You don't really want an answer from anybody, you just want to talk.
Well, having had that blanket from her, it's kind of symbolic of the fact that she's there for you, isn't it? And sometimes it's enough to know that person's thinking about you. You know, they're there, even if they're not in contact at that moment, you know they're there for you.
Especially as a sister, and who's, as a younger child, who I used to share a bedroom with, and we used to hate one another, and I can really say that and mean that. We used to fall out something dreadful. Now she's over the other side of the world, you know, it seems a lot better, you know, she seems a lot closer, even with the blanket and what have you, and I like the thought of her being closer. And it's things, how things change, you know, how your perspective change on life as well, and things like that. And even my brother, you know, he lives in Scotland. I don't see him very often, but even talking to him was good, and seeing him, you know, and what have you.
Well, I think you've really given a lot of things for us to think about, and also for the viewers to take away. And I want to really thank you for coming in today and sharing your story with everyone.
Thank you.
And I wish you all the best for the future.
Me
Thanks
too.
very much.
That's all right. You're very welcome, both of you. Thank you.